Once you decide on your coverage, you're ready to enroll. So let's explore enrollment periods. Most people first enroll in Medicare during their initial enrollment period, or IEP. Your IEP is 7 months long. It includes your 65th birthday month plus 3 months before and 3 months after. If your birthday is on the 1st, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You are enrolled in Parts A and B automatically if you're receiving Social Security or Railroad retirement benefits at age 65. You'll get your Medicare card in the mail. Otherwise, you need to sign up yourself online or at your local Social Security office. You may refuse or delay Part B enrollment and take just premium-free Part A. This may be a good idea for people who have employer or other coverage. Some employers require you to take full benefits, Part A and Part B, at age 65. You also may join a Medicare Advantage or Part D plan during your IEP if you're eligible. It is important to pay attention to the timing of your enrollment to avoid late penalties. We'll talk more about penalties in a minute. If you miss your IEP, don't panic. You have another chance to enroll called the General Enrollment Period, or GEP. The GEP is January 1st to March 31st every year. You can enroll in Part A, Part B, or both. If you're eligible, you can join a Medicare Advantage or Part D plan until June 30th of the same year. Late enrollment penalties may apply depending on your timing. Again, we'll get to that in a minute. You must be enrolled in both Part A and Part B to be eligible for a Medicare supplement plan. You are not subject to medical underwriting for 6 months after you enroll in Part B at age 65 or older. You can still apply for a supplement plan after this time period, but you may be denied coverage or charged more based on your health history. Some states may allow for additional open enrollment periods. For example, in New York, you may not have to go underwriting later at a later period, but you may still be subject to pre-existing condition for a 6-month period if you had a lapse in coverage for more than 63 days. Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B and Part A if you haven't already. You may enroll in a Medicare Advantage or prescription drug plan within the first 2 months. It is important to pay attention to this timing. As we have mentioned before, both Part B and Part D charge late enrollment penalties. The Part D enrollment deadline is especially important since it happens quickly and can sneak up on you. One more thing, make sure your employer provides you with proof of credible drug coverage. This means it is at least as good as Part D provides. If your drug coverage doesn't meet these standards, you could be penalized. Remember that your 6-month Medicare supplement open enrollment will be triggered once you are enrolled in Part B. Also, you must be enrolled in both Part A and Part B before you can enroll in a Medicare Advantage plan. So we mentioned penalties a number of times. Let's take a closer look at them. Part A, Part B, and Part D may charge late enrollment penalties. The Part A penalty doesn't apply to many people since most of us get Part A premium free, but for those who have to pay, the penalty is an additional 10% of the premium amount. You pay the penalty for twice the number of years you could have had Part A but didn't sign up. The penalty for Part B and Part D could apply to more people. It is important to understand the enrollment periods we just discussed and to enroll on time in order to avoid them. The Part B penalty is an additional 10% of the premium for each full 12-month period you could have had Part B but didn't, unless you qualify for a special enrollment period. You pay the penalty for as long as you have Part B. The Part D penalty is an additional 1% of the current average plan premium for each month you're late. You pay the penalty for as long as you have Part D. So hopefully you enroll on time and with no late penalties. And that's it, right? We're done. Well, not exactly. Medicare is not a one and done decision. Things may change in your life, your health, your finances, or even in Medicare or your plan. So it is important to review your coverage every year to see if it will work well for you going forward.